So, conclusion. We alert the people to be anxious about cancer. If we manage to detect the cancer in the beginning, I think we shouldn't go to various later stages. And personally, I feel very sorry when a woman comes to my office with a huge tumor in the breast. Perhaps this disease could be helped very much if even the woman itself could palpate her breast or seek help from any doctor. And an echogram would be nice every 3 months or every 6 months at least. A mammogram every year or 2 years. And follow-up would be the best solution. We're doing it in ladies with the mother who had cancer. We're very anxious about that. And sometimes we have got a very little benign tumor. It might remain benign, but if not, can be a cancer. So, the conclusion is to get the cancer in the earliest possible stage, and the doctors know what measures will take after. Thank you very much.
Thank you.
Dr. Sloan from the back, Dr. Mirza, Dr. Mirza, Dr. Mirza, come back up to the, if you have, we'll have a few minutes for questions. If you'll tell me to which professor you want the question directed, we'll try to accommodate you. So are there any questions just now? Maybe it'd be best if you come down here, because I can't hear you. Or if I can't hear you, maybe others can't hear you.
One of my main questions is for the Dr. Fabrice, who's just presenting on cancer. When you're talking about people having anxiety about it and becoming more aware, I think that people would, if they knew what were some symptoms that might indicate something more severely wrong with them. For breast cancers, once the tumors are appearing, they're already coming pretty well along. But internal cancers, how would a person know that there's something more wrong than, let's just say, a digestive problem or a sleeplessness problem? What would be some of the symptoms that would indicate cancer growth internally in those other areas that we were seeing on the charts? Because most people would not jump to say, oh, I have cancer. So what would be those symptoms? Like you said, you need to look for symptoms. What would be the symptoms that they should look for?
Dr. Jeffrey Honest, would you like to take a crack at that?
The tumor in the breast is painless, unfortunately. So, palpitation and echograms are the best way. The woman has to be anxious, unfortunately, because sometimes discovers a tumor in the breast, taken apart or something, and that's it. There is no way of, well, we can do a lot of investigation. By the time we're doing, the woman is okay. We don't know what's going to happen 3 or 6 months or a year later. So the investigation has to be not very many investigations, but it's got to be constant, and the patient has to be anxious for to seek advice anyway, even from any doctor. The gynecologist can do that when they go to the gynecologist, just to feel the breast. And investigation and investigation, that's all, because it's coming suddenly.